So a Nigerian dietitian arrived Manchester with a polished CV, a confident smile, and a story that NHS was ready to believe. Ifenyinwa Chizube Ndulue-Nonso, already registered in the UK and freshly relocated from Nigeria, stepped into a senior band 6 role at Manchester Royal Infirmary like someone who had finally cracked the code to a better life. On paper, she looked ready. In person, she sounded ready. In reality, a tribunal would later say she was anything but. What began as a career breakthrough in February 2024 soon curdled into one of the most embarrassing professional scandals to hit the UK dietetics field in recent memory. Within days of starting work, colleagues say the cracks were no longer hairline. They were chaos. Basic anatomy became a stumbling block. Simple clinical questions turned into red flags, and the woman hired to guide vulnerable patients through specialist nutritional care was allegedly unable to explain some of the most fundamental concepts of the job. The job was no small one. Manchester University NHS Foundation Trust had hired her for a senior rotational post, a role demanding deep clinical knowledge across eating disorders, cancer care, gastrointestinal disease, dysphagia, artificial feeding, obesity, and multiple specialist hospital settings. She had spoken confidently in her application and remote interview, describing herself as experienced, capable, and familiar with complex areas of dietetic practice. The panel believed her. She got the job. She moved countries. She started on February 19, 2024. Then came the questions. According to evidence later examined by the Healthcare Professionals Tribunal Service, supervisors quickly noticed alarming gaps. She reportedly struggled to identify where the intestines are. She mixed up the small and large intestine. Asked about the gallbladder, she allegedly gave an answer so wrong it stunned the tribunal, describing it as part of the kidney where urine is stored. BMI calculations tripped her up. Feeding tubes were a problem. Dysphagia, colic disease, IBS, refeeding syndrome, treatment planning, pharmacology, biochemistry. One by one, the gaps stacked up like collapsing scaffolding. To her colleagues, this was not nerves. This was not culture shock. This was not a rough first week. This was a danger in lane yard. Supervisors moved fast. She was kept under strict watch, denied unsupervised patients contact, and pulled into close supervision almost immediately. By March 12, 2024, less than a month after starting, she was suspended. What was meant to be a fresh chapter in the UK had become a professional freefall. The tribunal that followed did not mince words. Over hearings in March 2026, the panel concluded that Ndulue-Nonso had exaggerated seriously and repeatedly her knowledge and experience to land the role. They found that she had falsely presented herself as having in-depth competence in at least 20 specialist areas. Yes, she had some background knowledge from her training and limited outpatient work in Nigeria, but not the kind of expertise expected of a senior NHS hospital dietitian, not even close. At this, the panel said was no accident. They described the deception as planned, wide-ranging, and persistent. She had reportedly attended around 15 NHS interviews before this one, learning the right phrases, the right tone, the right answers. By the time Manchester offered her the job, the tribunal believed she knew exactly what she was doing. Her claims were not careless embellishments. They were, in the panel's view, deliberate fiction dressed up as professional confidence. Her defense tried to soften the blow. She admitted to overstating things, but framed it as minor, a little exaggeration, a bit of overstatement, maybe even misunderstanding, but the tribunal was unmoved. They found little genuine remorse, limited insight, and no convincing explanation for the scale of the dishonesty. In the end, the verdict landed hard. Struck off. Not suspended, not warned, not gently shown the door. She was removed entirely from the UK professional register. The tribunal ruled that nothing less would protect public trust in the profession. A dietitian, after all, works with sick patients, fragile patients, patients whose care depends on expertise being real, not rehearsed. The NHS Trust, for its part, insisted no patients were harmed. Staff identified the problem within days, kept her supervised, and acted quickly. Recruitment procedures, the trust later said, have since been strengthened. By that, reassurance only sharpened the bigger question hanging over the case. How did someone with such glaring gaps get through in the first place? That is why this story traveled fast, from UK outlets to Nigerian headlines. It wasn't just about one woman losing a job. It was about a system that almost let confidence outrun competence. A profession built on trust had to confront what happens when credentials sparkle, interviews impress, and the truth walks in later wearing hospital ID. For Ndulue-Nonso, the promise of a UK career ended not with promotion but disgrace. One application, one interview, one relocation, and then, under the fluorescent lights of scrutiny, a professional empire built on exaggeration came crashing down. In the NHS, confidence may open the door, but sooner or later, competence has to enter the room. This is what I found about this woman, Ndulue-Nonso Ifenyinwa Chizube, from College of Applied Food, Science and Tourism. Then this is her biodata. She's from Anambra State, Nnewi North. She's married, area of specialization, nutrition and dietetics. I don't know if she paid them to put her details on their website, because I'm very sure very soon they are going to remove all these details. Objective: to prescribe foods that will contribute to the management of diet-related diseases and well-being of a group, patient or other individual. Qualification obtained with this: 2011 to date, Michael Okra, University of Agriculture, Umudike Umuahia, MSc Community Nutrition in View. 2004 to 2008, Michael Okra, University of Agriculture, Umudike, the same Michael, BSc Human Nutrition and Dietetics. 1994 to 2000, she got her West African Examination Council. Then 1989 to 1994, she did her had a primary school. Then work experience 2014 till date, technologist dietitian, Department of Human Nutrition and Dietetics, Michael Okra University. So she's actually she was working at Michael Okra University, and yet she doesn't have this understanding. So what was she even now teaching students? Her responsibility is to teach students practicals on therapeutic diet preparation, of nutritional status and food production. A woman who could not identify gallbladder, gastrointestinal, issues, is a teacher at, College of Applied Food and Sciences and Tourism. So that's why, they are raising half-baked graduates in this country called Nigeria. Guidance and supervision of student project work in the laboratory, developing practical manuals, invigilating undergraduate examinations. That's just it. 2012 to 2014, she's an assistant lecturer, Anambra State College of Agriculture. You could imagine, you could see that. So 2014, she got, employed at the Department of Human Nutrition at Michael Okra University. She was assistant lecturer at Anambra State College of Agriculture from 2012 to 2014. Then from 2010 to 2011, she's a dietetic intern, University of Nigeria Teaching Hospital. So look at the offices she occupied. Despite occupying these offices and working on, on this in these reputable universities, she doesn't have this basic knowledge. That's the problem. A decay in Nigeria education system. Responsibilities: nutrition, education, and dietary, counseling of in and out patients, modification and preparation of fluid diets, supervision of therapeutic diets preparations. 2009 2010, she's a nutritionist, Sir Yahaya Memorial Hospital, Benin Kebbi. A lot. And if she overstated her role, at the NHS, how am I going to believe all these things she's, presented here? Trainees, a 6-day training course under NYC Reproductive Health, HIV/AIDS prevention. Then participated in a training course on severe acute malnutrition at you know how these training courses are. You won't even get much. course on caring for infants and children with acute malnutrition, organized by the International Malnutrition Task Force. The use of WHO Antro software assessment, all this rubbish. She is actually put the Nigerians working in the UK into big scrutiny now. So every Nigerian health worker, you're a pharmacist, you're a doctor, you're a nurse, even a dietitian, wherever you are, they will have to scrutinize, your qualification because of this woman. This is terrible.